When a person receiving dialysis or a clinician has a concern about mental health symptoms, there are a number of questionnaires that a person can answer. We want to highlight 4 common questionnaires used in AHS and Alberta Kidney Care: the ESAS Renal, the PHQ-9, the GAD-7, and the Columbia Suicide Severity Rating Scale. The ESAS Renal is a symptom assessment tool tailored for people who are experiencing chronic kidney disease or who are being treated with dialysis. The ESAS Renal asks people to self-report the severity of a wide range of symptoms they may be experiencing, including symptoms of anxiety and depression. Each symptom is scored on a 0 to 10 point scale, with 0 meaning no symptom and 10 meaning the worst possible experience with the symptom. Clinicians can invite a person to complete the ESAS Renal and then interpret the score in a conversation together. This conversation is important because different scores can mean different things to different people. The ESAS Renal can be found in Connect Care. The Generalized Anxiety Disorder 7, otherwise known as the GAD-7, includes 7 questions for people to self-report anxiety symptoms. If a clinician had concerns about symptoms of anxiety, they may invite a person to fill out this questionnaire. The GAD-7 total score ranges from 0 to 21. The higher the score, the worse the person's anxiety symptoms. It is important for clinicians to invite the person to interpret their GAD-7 score. Once again, different scores can mean different things to different people. The GAD-7 can be found in Connect Care. The Patient Health Questionnaire 9, otherwise known as the PHQ-9, includes 9 questions for people to self-report symptoms of depression. If a clinician had concerns about symptoms of depression, they may invite a person to fill out this questionnaire. The PHQ-9 is scored on a 0 to 27 point scale. The higher the score, the worse the person's depressive symptoms. However, what's most important is to learn from the person receiving dialysis what the score means to them. We know from decades of research that a score of 0 does not mean that the person has no depressive symptoms. Once again, different scores mean different things to different people. Therefore, a clinician needs to invite the person to interpret their PHQ-9 score. You can find the PHQ-9 in Connect Care. The Columbia Suicide Severity Rating Scale is a tool used by clinicians to assess suicide risk in people and the immediacy of the risk. In case you are a nurse watching this video, it is important for me to mention that suicide risk assessment is a basic competency for nurses in all areas of care because suicide touches people from all life experiences. The last question of the PHQ-9 asks about thoughts that you'd be better off dead or of hurting yourself in some way. If a person receiving dialysis answers this question with several days, more than half the days, or nearly every day, then ask them to complete the Columbia Suicide Severity Rating Scale. Unlike the GAD-7 and PHQ-9, the Columbia Suicide Severity Rating Scale uses yes or no questions to assess suicide risk in the moment. It is an important tool to guide patient care and safety. The pathway for mental health for adults receiving dialysis provides next steps depending on the severity of the risk. Clinicians can find the Columbia Suicide Severity Rating Scale in Connect Care.